Welcome back to Better Preparedness. 48 hours from now, South Africa will already be under what's called lockdown. And it is a very strange situation. There are a lot of misconceptions going around, and there's a lot of sensationalist media, and more the mainstream medias just keep focusing on the ultra negative and the fear-mongering, which frustrates me. And I think even the term lockdown is really not an accurate one. So that's what we're going to get into is, well, what does this all mean? And here in South Africa, but also elsewhere. 2 days ago, President Cyril Ramaphosa here in South Africa announced a lockdown for 21 days starting effectively 23:59 on Thursday. So as you go from Thursday into Friday at midnight, lockdown for 21 days. But the problem is that lockdown, it almost implies that there's some sort of mass chaos. There are armed people in the streets. There's sort of anarchy and everything. That's not the case. What this is about is keeping people apart. COVID-19, the coronavirus, has proven itself to spread quite quickly. If there's an inaction, or if you were one of the first countries like Italy and South Korea, you saw your cases surge. And Italy is now up to about 70,000 cases confirmed and almost 7,000 dead. And that's pretty serious. And any of these numbers, and I think globally it's about 420,000 or something like that reporting, any of these numbers are really the tip of the iceberg. They represent about 5 to 14 days ago, because so many of these numbers are just not, it takes a long time for it to brew within people, so to say, and for it to then surface, be detected, be recognized, and be confirmed. Any of these numbers are serious because they are what was about 5 to 14 days ago. Now, in South Africa, the numbers are still fairly low, so to say. We're talking 554 official confirmed cases as of yesterday. But what we've seen in other countries is that inaction leads to a skyrocketing number. And I think we can say this for the United States. The inaction is going to cost the United States. For the later your startup of your outbreak, the more you get to see what has happened in other countries. If we look at China and Wuhan, and the healthcare services could not keep up. A lot of healthcare workers got sick. This is probably also due to stress and overwork, which makes you even more susceptible to the virus, which then depletes your ability and your pool of nurses and doctors and even the people who are sanitizing these hospitals. But it's also going to be your paramedics, your ambulance workers, your firefighters, your police. Again, all these people are going to be more and more susceptible. So what is lockdown? Well, lockdown is about keeping people apart. It's not about panic. It's really forcing people to stay indoors and forcing people to stay at home. Now, it's not a collapse of society. All the essential services are going to be available. And it's been made very, very clear. You will have access to grocery stores, to pharmacies, to your social infrastructure that is required. It is not about ceasing life as it is. It's about taking a break, because right now what is happening is that way too many people are interacting still, and that virus is spreading. And that virus, as we saw in that first video here on Better Preparedness, is rather invisible. And that's one of the challenges that the world is having with this virus, is how you can't even really see it. You can be touching the surface and then touching your face, or be in the presence of someone who's mildly sick, but you don't really realize it, and now you're catching it. And I think South Africa is doing the right thing. I think it is something that is, the longer we wait in other countries to take this action, the more it's going to have repercussions. And the problem is that if South Africa doesn't do this, it will just, the cases will escalate. And especially in the poorer populations where you have cramped living conditions, you have high rates of HIV and TB, tuberculosis, all those make you more and more vulnerable to it. And places like Italy, although they don't have necessarily high rates of TB and tuberculosis and HIV, in places like Italy you have an aging population, which means that's also one of the vulnerable groups, particularly vulnerable groups. And don't be thinking this is just an older person or a sick person's virus. a number of young people, the young have also died and been in extremely difficult situations because of this virus. So take this seriously. Is this fun? Absolutely not. No, this is going to really impact the economy. If we here in South Africa and if other countries don't do this, what you're going to have is you won't be able to catch up with what's happening. And so this is, you can call it a lockdown, but I would actually like to say this is a keep people apart down. For people who need to visualize, we have, let's see, Darth Vader and a stormtrooper here. If these are the carriers of the virus, and you have the elderly and the frail, let's see, we have this lady and we have Mr. Yoda, a bit of a 1970s thing here. If these people are out and about and they're touching surfaces, they're taking public transport, they're going to the grocery store where people have been touching various things, then guess what? Now you have these people infected. Now you have, let's see, we have other population coming in contact with them, and very quickly you have, even more people coming in contact with them. And let's see, and guess what? Now your healthcare worker can't cope, and your healthcare system is overwhelmed because they can't handle the volume. Very quickly, if we don't do anything, this is just going to get out of control, as we've seen in Italy. And when you've got 70,000 cases, 7,000, almost 7,000 deaths, that is pretty serious. So that's a wake-up call. Is 21 days going to be fun? No. For a lot of people, it's not going to be much fun at all being isolated, and there's going to be impacts to the economy, job losses. Some companies won't recover from this. But if we don't do this, it is going to have a massive impact on the economy. There will be far more job losses. So this is an investment right now. And take some time, be with your family. We have less than 48 hours to find somewhere to sit down. But be careful to not go out and sort of touch all these things as well. This is all about keeping people apart. If we keep people apart, we keep the virus away from people. So go out there if you need to buy a few supplies, but do not hoard. All the services will be available. And when I went grocery shopping the other day, you're not going to go hungry. I see people hoarding junk food and canned food. You don't need to do that. You can just buy healthy food and there will be a supply. Maybe have a week to 10 days on hand. But that doesn't mean hoarding everything, and certainly doesn't mean hoarding the toilet paper. I still haven't figured that part out about why people in other countries hoarded the toilet paper. But all this to say, relax, take care, look after your friends, keep those reminders in mind, wash your hands for 20 seconds frequently, don't touch your face, try not to touch too many surfaces, avoid contact between people. Just keep apart, and we've now got the technology virtually to see each other on a regular basis. It's not much fun, but stay home, help others, be in contact with others. If you have friends who are are perhaps in self-isolation, well, offer to buy them groceries when you will be out and about. Do a check, see who's impacted by this, and see how you can help. And buy a few things, subscribe to a few services to keep you busy. Go buy some model kits, or if you have a garden, go buy some gardening supplies, and make sure you do support businesses. And if you're out and about, tip heavy. If there's places where you can tip, and share the love, and make sure that once this passes, you also then go back to your businesses. But it's also going to be, I think, this 21 days is not going to be over and then boom, we all return to normal and all the hustle and bustle. I think there's going to have to be a sort of a return to normal over a period of time, but it's not going to be sudden. All right, well, keep watching Better Preparedness. Hope to help keep your spirits up, give you a bit of insight in my work in emergency management. And now it's time to go. I don't know if you hear that. That's an airplane. I haven't heard many of these for the last quite a few days. So anyways, keep healthy, keep your spirits up, help out by keeping distance so that that virus can't just keep spreading and going from one population to another. take care of yourself, take care of your loved ones and those in your community, and keep it local. Just focus on your local, and we'll get through this. All right, take care from, well, South Africa on a beautiful, as usual, sunrise morning. Thanks for watching Better Preparedness. Click that like and subscribe button, and stay tuned on betterpreparedness.com. Lots of material for you. Thanks for watching.